All right, we are going to finish up here talking about ways to maintain your pelvic health long term, whether you have good pelvic health to begin with and you just want to make sure you're doing all the things to maintain it, or if you have some dysfunction, these are some things that might help, or if you've gone through pelvic floor physical therapy, these are some things to keep in mind just to maintain all that progress that you've made. So the very first thing is just mainly to stay active and stay hydrated. So whatever your choice of activity is, just keep doing that, whether that's walking or lifting or strength training or Pilates or yoga, whatever your choice is, just keep active. As you're moving through all those activities or doing whatever your activity is, you're forcing your pelvic floor to both lengthen and strengthen, both of which are critical components for long-term pelvic health. Along with that, you want to make sure that you're really staying hydrated. Keeping your bladder happy will keep your pelvic floor more happy as well. If your bladder starts to get really unhappy because you're really dehydrated, your pelvic floor is going to start to develop more dysfunction as well. The next thing that can be really helpful in maintaining good pelvic health is managing intra-abdominal pressure. We talked at the beginning about the connection between the diaphragm and the pelvic floor muscles, as well as the abdominal wall, how there's a structural connection between all those muscles and systems, but also how all those things work together to maintain optimal pelvic health. And those three components in particular are super important in managing pressure. When you get a big increase in abdominal pressure, it puts a lot of pressure down on your pelvic floor, which makes it really hard for it to do its job, and it really puts pressure on those organs, which again makes it really hard for the pelvic floor to do its job. So the best way to do this is to think about exhaling on exertion. So what that means is when you do movements that require a lot of effort, you want to try to exhale during those movements. So thinking about things like lifting or pushing something really heavy, even sometimes if you're holding something, or even if you're not holding something, even sometimes something as simple as standing up can increase abdominal pressure. Along with that, you want to think about things during your workouts that increase abdominal pressure, like things like crunches or sit-ups or squats or deadlifts, anything like that can increase pressure. And so you want to really make sure that you're paying attention to your breathing patterns throughout your whole entire workout. So I'm just going to show you an example of a sit to stand just because it's really simple, but it's also like the second half of a squat. So as you think about kind of standing up from a squat, it's the same exact motion, and you want to make sure you're exhaling during that motion. So if you're just moving from sit to stand, you would inhale first and then exhale as you stand up. So just one more time, you'll inhale first and then exhale as you stand up. So again, that's important to just think about with day-to-day life things, but also during your workouts or your choice of activity. The next thing that's important for maintaining good pelvic health is maintaining good strength and length of your pelvic floor, your abdominal muscles, and your glute muscles. So we're going to practice a couple pelvic floor contractions. I'm going to give you some cues for this. So to do a pelvic floor contraction, you can think about a few different things. I like to talk about thinking about really lifting up from your vaginal opening or kind of closing off that vaginal canal and pulling in. Or you can even imagine that you're trying to pick up a raisin with those pelvic floor muscles. So thinking about kind of close and pull in here. You might feel a little bit working in your abdominal muscles, but you should definitely feel it kind of between those sit bones, between those bones that you're sitting on. So again, that's kind of close and pull in or lift up. As you kind of get the hang of this or think about this a little bit more, you can also practice this with your exhale. It's really important that over time you develop this connection of exhaling and engaging that pelvic floor. That also helps with managing abdominal pressure like we talked about. So this looks like an inhale first, and then exhale and lift. Right? So inhale first, exhale and lift. You can practice these pelvic floor contractions in any position. Typically laying down is the easiest. Sitting would be the next most challenging, and then standing, and then doing it during movements like, for example, when you're standing up from a squat or standing up from a chair would be the most challenging. So you can practice in any position that you want. The last kind of exercise I'm going to show you here is a good stretch in sitting. That's really good for your glute muscles and also get some of the pelvic floor muscles as well. So you're gonna cross one ankle over your other knee and then just lean forward here. You can put a little pressure down on that knee if you want to with your elbow, but you should feel a really good stretch in this muscle back here. And then you can also just know that this also is getting some pelvic floor muscle stretching as well, although you won't feel it directly in there. And so then we would switch and do the other side as well. Alrighty, so the last thing that I'm going to talk about is the final piece to kind of maintaining this good long-term pelvic health is making sure that you're going to your pelvic floor physical therapist when you start to see any signs of dysfunction at all. So like we kind of talked about earlier, that could be bladder dysfunction like leaking or urgency, bowel dysfunction like constipation or incontinence. That could also be pressure or pain or difficulty with sexual activity, anything like that. Along with that, it's important to go see your pelvic floor physical therapist whenever you are pregnant, just to maintain good pelvic health, just to get tips to support your pelvic floor and your abdominal wall throughout that pregnancy, but also to help with birth preparation activities. There's a lot of things that we can do to kind of help prepare the pelvic floor to minimize the risk of dysfunction or trauma that happens during birth and after. Along with pregnancy, after childbirth, you want to go see a pelvic floor physical therapist. Again, if you see any signs of dysfunction, you definitely want to get in as soon as you can to kind of attack those problems right away and not let it fester into bigger problems long term. But also you want to go see a pelvic floor PT after you have a baby, even if you're not having any symptoms of dysfunction, so that we can make sure that everything is healing how it should and things are returning to normal in your pelvic floor so that you don't develop dysfunction down the road. Finally, you would also want to go see a pelvic floor PT when you start to see other signs of menopause, especially if you can get in when you know you're in menopause, but before you start to see any signs of dysfunction. But then again, too, if you start to see any signs of problems, then that's also a good time to go in. But it's important to just get in when you need to, and then also for checkups during those 3 different time periods in your life. Okay, like I said, my name's Keira. I work at Family Physical Therapy out in Enumclaw, and then I also do mobile physical therapy through Venus Physical Therapy and Fitness, where I come to your house to do treatments. And I just want to say thank you for listening to all of this. I hope that your pelvic floor stays nice and happy and healthy for the rest of your life.